get started. I'm not sure how you guys want to do this. I've got a list of 6 people. Are you all going to speak one at a time? How is this going to work?
I'll start it, and then they'll follow. Each has a small presentation, and I think by the time we're finished, we'll all understand each other better.
Okay.
All right. We'll go over here. I guess that's the order to do it.
That'll work.
Okay. And you may or may not have one of these, so just kind of make sure everyone gets one.
And for the minutes and things, anytime you come up, I'd like you to state your name, please.
Oh, yeah. My name is Earl Callahan. I probably have served less time than any of these other veterans here, from August 60 to August 63, U.S. Army. Okay? And it's nice. Finally, we're here to help you people, actually the larger board, etc., begin to right a terrible wrong. And that's the place of ESO in Chenango County. It needs to be done. And visualize, if you will, that you've been trained to kill. To take a human life, to violate biblical directive, biblical doctrine. And that's a terrible responsibility. And then you come home. And to what? Nobody cares. That's the way it looks in Chenango County. That's not fair. That's not fair to even recognize the job you did or conducting war. That's not enough. So, I think as veterans, I've spoken with a lot of people in the American Legions and things like that lately. And we've come up with a few questions and directions for you. We want to get it done. And from what I'm hearing, you do too. It's a must. You've got to do it. I know we serve at the boss here. We serve.
No, I'd like to correct that.
Go ahead.
I am not the boss.
Okay.
I act at the direction of the committee system and the board of supervisors. I have no authority other than what they give me.
All right. Something that we really want to do, we want you to conduct interviews to get a person. And when you start those interviews, we'd like to know who's going to conduct them. And we think that they should be conducted with a veteran at hand, either a county commander or a post commander from, say, the American Legion. That's what we think. We'd like to be there when the interviews are conducted. It hasn't been placed in the budget. We wonder why. And why hasn't it been done sooner? I would suspect you're going to do it next time around, and maybe even try and place it right now. And I think the final thing we want to ask is, how will you follow through? How are you going to do that? Do Chenango veterans need to get the Attorney General involved? I don't think so. I think you guys are ready, and ladies, are ready to do it. But there's a few questions that need to be answered. And I kind of yield my time to the next person on the list. Jason?
So do I need to be there?
That would be best.
Okay. Good morning, my name is Jason Miller. I'm from North New York, Army veteran. I come down to support my fellow veterans, and I want to thank all of you all. I look around here, everybody here is a public servant. You know, we're out here serving our communities. The thing about veterans is that veterans we basically put our country, our community, and our lives before anything else. And as Mr. Callahan stated, when we come back here to Chenango County, where we choose to live, we don't have the support system that surrounding communities have. And to me, this is a big miss. The reason why this is such a big miss for me, because I choose to live here and I try to make things better. I've written letters to Bob and Jim and to Mr. Wanzer here, Dr. Wanzer. You know, without a veteran service representative, I look at this agenda here and I see all these other positions to fill out, you know, roles in the community. And these are other services that, you know, the veterans of this county have to take care of, right? We have to go and use these services instead of going directly to a veteran service officer. So there's 50,000 people in Chenango County. If you presume that half of those are adults of voting age, and then you divide the number of veterans, which is 4,300 in Chenango County roughly, that's about 20%. 20% of the adults in Chenango County have served this country. But we don't have a veteran services officer here to support us. Some of us are young, some of us are old, some of us are, well, wherever Joe Coe is, right? And, you know, we need this person because we're not the types of people that are interested in a handout. We don't feel that this is an entitlement. We feel that this is something that we had earned. And it's my understanding that the state will help pay for this. I know that there's been a lot of conversations. This guy's got a piece of information, this guy's got a bit, this guy's got a bit, I got a bit, but there's no centralized person that, as a veteran, I can come to and relate to. You know, no offense about the social services, but if I come in there, you know, like, they don't have the happiest jobs. They're not, you know, they don't necessarily understand where I've been, or what I've been through, or what Mr. Tucker's been through, or what Mr. Hoxley's been through, right? And we don't necessarily like going down there and asking for help, right? It doesn't fit into our demeanor. And when you take all those veterans that have to come down here and ask for help, well, if you shift them to a veteran services officer, it's going to be more efficient. I think that's really the trick. I mean, you've got to add all these different people. You keep adding these people in the social services when we're just asking for one, maybe two people, which would reduce the amount of resources necessary to operate, you know, the social services or the community services organization. So, I think, these are some of the things that we can think about and consider when we're looking for a VSO. And thank you very much.
Thanks, Jason.
Mr. Tucker?
Morning, Ed.
Morning. My name's Ed Tucker. I am from Norwich. I was born here, brought up here, educated at the high school across the street. Went in the Army, stayed in Kentucky, came home 3.5 years ago. And I'm here today to speak on the behalf of veterans. I would tell you that I spent 30 years in the Army, 1960 to 1990, and attained the rank of Command Sergeant Major, which means that I was the enlisted speaker for enlisted people to the commanders from a number of 600. My last job, there was 5,800 people that I spoke for. And I'm here to speak because that's my job on behalf of the veterans. I've heard numbers thrown around. I know what the census said in 2010. I'm not so unsure of how many, or I am unsure of how many have passed since that time, but I do not know how many more, and we got 2 more years to figure that out. I do know that everywhere represented today at this board meeting, there are veterans in your area. I could give you names, and I know some of you are family of veterans. And uninterestingly, I was looking up obituaries of Legion members, doing some history of the American Legion, and I came across a report, 1946, of a guy that was called the Veteran Service Officer that at that time, and he was given a report to a committee here on the Board of Supervisors. But I looked at it, I thought it was interesting that back right after the war, they had this committee, and I don't know what happened to it after that time, but I think there's as much of a need now as there is and was in that time. There were probably a lot more veterans after World War II because it was a war that everybody was behind. But that doesn't do away with the personnel that have served since that time. My part of the service goes back to my uncle who served in the First World War. And my dad did not have to go. He was not taken. There were 4 of us in the family, and they told him to go home and take care of us. Thank God he did. Then one of my children had served. I have a stepson who served, but this, after 2 years, did not. I made a career of it, and I'm going to make a career as long as I live to speak for veterans and whatever else they need to have spoken for them. I should have done more as I first came here, but I didn't. I would tell you that we probably need to start slow, but we need to be ready to go at a faster rate. The guy that was mentioned, Jack Ensign, started in the program. It was already started. Working 2 days a week, and very shortly gave up more than that time, and now works 5 days a week with the number of systems that you heard, 3 to include a driver to get people to Syracuse or wherever they have to go. I was a volunteer driver in Kentucky for 5 years with the DAV program, taking people from Radcliffe, Kentucky, where I resided, to Louisville, Kentucky, to the VA hospital. And sometimes I drove 5 days a week. There's a need. You're going to find there's a lot of veterans back wherever that just won't come out and speak because they don't want to be a burden on somebody, or they just don't know. I think that the one place that we're behind the 8 ball anywhere is getting someone certified to do this job, because certification is a requirement. The next certification class, to my knowledge, starts in May, but and if you're not registered by the 1st of March, we're not going to get in the May one, and we'd have to wait till October to be in the next class. They do it twice a year. And I think the law says something about 18 months that the guy can work in a borough, work in the job without being certified, but there's got to be action towards that. I'd ask if there are any questions. Thank you for your listening. I appreciate it.
Thank you, Ed. Thank you for your service to our country.
Morning.
Morning.
My name is Eric Luther. I'm from New Berlin, New York. I served in the Army for 4 years. I spent 22 months in Iraq. I'm not a lawyer. I'm going to assume everyone here knows what the laws and everything says about this particular position. I just want to talk about veterans. I'm going to contradict you a little bit. Veterans make up approximately 10% of the voters in Chenango County, 18 or over. Of the total population of Chenango County, they make up about 7.5% of the population. Chenango County is one of the most densely populated veteran counties in the state of New York, with 93 of every 1,000 people being veterans. Chenango County allotted 5/10,000ths of 1% of their budgetary appropriations to veterans. $400. $400 out of $90 million for veterans burials. That's it. I wish my father-in-law, Mike Wright, were here so I could ask him how much a burial for $400 would give someone. He would probably laugh. The county allotted $1.3 million to drug and alcohol abuse. $400 to veterans. We'd be happy with 10% of the support the local drug addicts get. How can it be there's so much money to help folks who willfully make these mistakes? And I don't want to seem naive. I realize that there are probably a lot of veterans who were in those numbers of people who were drug and alcohol abusers, because that's what we do. Because in 2014, the Veterans Administration did a study that said veterans are among the least likely people to seek help. And that if the help isn't readily available, if there's not that support readily available, then they're going to give up. And they're going to lubricate and medicate themselves with drugs and alcohol. That's what we do. So knowing these things, I think we can maybe put to rest the idea, the notion that there's no interest or need in this position. I'd like to talk a little bit about our neighboring counties. Otsego County, I looked at all the budgets for our neighboring counties. Broome and I can't think of the other one off the top of my head, but they were unreadable. But Otsego, Delaware, and Madison County were pretty clear. Otsego County spends over $146,000 on their veterans program. Delaware County expenditures of $211,000, and Madison County expenditures of over $259,000. And those counties, I think, are better than Broome to compare to Chenango anyway, because the numbers are more similar in veteran and total population. So I don't think that it's unfair or unreasonable for us to be here asking it be considered that we not only get someone in this position, but someone who's full-time in this position and a veteran who is fairly compensated. How many veterans in this room, how many people in this room are veterans? Right? How many of you veterans have an e-benefits profile? I do. One person. I'm one person. I went to one Legion meeting in New Berlin, and I've already had one person ask me, hey, can you help me get my DD-214? An e-benefit program, just a quick hour. That person could have that. To sit down with them. If someone would sit down with them and make this profile for them and show them how to use this, they could get it digitally. It's that easy, but that person doesn't exist. I want to talk a little personally, if I may. I left the Army in August of 2009 to go to school. It was George W. Bush, President Bush, in 2008 gave the Veterans Administration 1 year to implement their new Montgomery or post 9/11 GI Bill. That was in August 2008. So in August 2009, I got out with an eye towards going to school and using that GI Bill. In August 2009, 230,000 veterans had applied to use that GI Bill, and 30,000 of them were getting it. I was one of the ones who was not. I spent $10,000 of my own dollars trying to put myself through school, didn't get any money from the VA, and when I dropped out of school, I got a $3,000 bill, which I couldn't afford to pay. So what did I do? I started drinking. I started smoking crack. I lived in Rochester at the time. I came out to Chenango County at 29 years old to live with my mom so I could get better. And there was nobody here to help me. I called my congressman. He put me on the phone with a guy named Doc Schmidt, who laughed at me and told me I was goddamn PTSD from the front door to the back door, his words. That's when I found out, and in 2011 my claim was denied. Even though it was put through by the Surgeon General of the VFW, my claim was denied. In 2014, I finally was able to get it through after a lot of fighting on my own. If there had been someone here in Chenango County that I could have gone to, who could have helped me, maybe I could have gotten that 3 years of compensation that I missed out on. maybe that would have been a little bit easier for me. Unfortunately, I had the support of my family and my community. New Berlin's an awesome community, and Chenango County's an awesome county. But this is a massive oversight, and this is a huge problem. And again, I don't think that we're asking too much. Thank you for your time.
Thank you. Thank you. Thank you.
Good morning, everybody. My name is Joseph Coe. First thing I'm going to do, I'll identify myself first. I'm a retired Air Force and Air National Guard with over 33 years in the military. I was also at one time VSO for Chenango County as a volunteer. As one of our veterans mentioned, $400 was my budget. When I started, it was $200, and they raised it to $400 for burial purposes. So, after a number of years of holding that position as a volunteer and seeing it not go anywhere, I got frustrated and I resigned. We're now here 10 years later, and we have no veteran service rep. I've made many contacts in the recent couple of weeks, not knowing that there was an organization that was pursuing Chenango County, filling this obligation for veteran services. You have a moral obligation to fill this position. I'm going to share with you, I'm going to hand out to you folks, stats from 2016. And I've highlighted Otsego County. Just go ahead and pass them around. I highlighted Otsego County, which is very comparable to us as far as veteran populace. As mentioned in 2010 census, there was 4,367 veterans on the census. Based on 2016, there was 4,060 veterans in Chenango County. I also mentioned that I got this information from the Otsego County Veteran Service Officer, okay, who was a full-time officer and started out 7 years ago as a part-time VCO. Very helpful. He developed quite a reputation and has served many of the veterans in Otsego County. As I said, he started out at $16,000 a year. He developed a program where there is 3 full-time personnel because of the demand. Started out part-time, working 30 to 40 hours a week. 20 to 30 of it was on his time, and expressed his concerns over those periods of time and developed a program in staffing. He has a full-time county employee who's a driver for the DAV. That individual gets $13 and, I write down here, $13, I think it's $13.52, $13.35 an hour with benefits. That equates to about $27,000 for a driver for the VA. And that's transport people to and from hospitals, and whether it be Binghamton, Syracuse, Rochester, wherever. So huge demand there. We don't even have a clue. Chenango County doesn't have a clue how many veterans we could serve. And how do we do that? You got to advertise it. You got to have somebody in that position with flyers, brochures like this, Chenango County, Veteran Service Officer, 3rd floor, Chenango County Office Building, phone number such and such. Very basic stuff. training, we touched on training just a little bit. The American Legion sponsors, can sponsor via through the post and through the command, Chenango County Post, the commander himself, to sponsor somebody, or let's say two people, to go to a training program which costs about $175. That's a pretty small piece of change to train somebody for the service of the veterans in this county. That's peanuts. As Mr. Tucker mentioned, that class is in May. Application deadline is March 1st. I don't know when the next class is. It's sometime September, October timeframe. I don't know when that application has to be in. It's an accredited program. It's recognized by the VA. American Legion's training program is recognized by the VA far beyond any of the other organizations. That'd be the Marine Corps League, the VFW. They all do sponsor a training program, but the VA looks at the American Legion training program as the best. And then there's continuing training after that, and an individual has to hold that position for at least 1 year with continuing training. So this position is in infancy, and how the county goes aboard in filling that position, I don't know. But this position has been vacant for a lot of years. A lot of years.
How many years has it been vacant, would you say, John?
Well, if you exclude Terry Berzina, who was the state VSO.
Yeah, you stayed. Yeah.
Okay, and he held the position or did the duties for Chenango County. So Chenango County really didn't have a position,
Right.
a position or a person on board. So if you exclude the number of years that he was a VSO for the state of New York, I'm going to say 30 years.
I was
Okay.
gonna say it's been a long time. Yeah.
Because I held it from 1997, when I was appointed, to 2008. And then from there, you had another volunteer. He wasn't there very long, and he was 80-some years old. No credentials, he was a veteran, don't take that away from him. But he didn't have the training or certification, nor did I. Okay? And so, here we are, let's say from 2008, or 1997, to present date. Chenango County hasn't had a position filled. So how long do we go? How long do you want to continue to do this? I mean, I think everybody here, and I think if we took and broadcasted it to Chenango, the people of Chenango County, the populace of Chenango County, you don't have enough room in this building to fill this building with a number of vets that are looking for help. So, one thing I also want to mention in regards to this draft that I gave you, okay, we don't really know how many veterans are receiving Medicaid. Without going through your files, probably HEPA's involved in that, so you don't know. I don't know the particulars. But based on this graph I just gave you, stats from 2016, that dependents, spouse, children, you had over $23,267,000 that veterans received in Chenango County in benefits that they spent in Chenango County. They paid their taxes, they put their children in schools, They bought groceries. Those are all benefits. Don't know what proportion of each, anywhere from a 100% disabled veteran to a 10% disabled veteran. Of that, it's got it broke down, $13 million was in pensions alone. And then it breaks it down into medical care. You got $8 million in medical care. Those are huge numbers. I step back and I say, look at Medicaid. How much is Chenango County paying a veteran if he's on the rolls for Medicaid, where he could be getting that benefit through the VA, which would save the county a lot of money. That's pretty much all I got, folks. Anybody have any questions?
What's a unique patient? What's that?
I don't know. I don't know. This I got from Jack Hansen last week. He sent it to me, the VSO from Otsego County. Very helpful. Another food thought for you too is this, is that if you put somebody in this position, you go through the interview process, you put a person in position at a part-time basis, until that individual is has its basic training down and is certified, I am very certain that that individual could reach out to the other VSOs in and around Chenango County and the state VSO to assist that individual in helping the veterans in Chenango County via the VSO for Chenango County. You're not just going to drop the ball and say, here you are, go with it. That's not fair to that individual. That's a disaster in the works. We want somebody in there that's going to be viable, professional, well-trained, with exposure, so that you got a contact information. When I was in the position, my contact was Len Sask.
Out of Oxford, yeah.
Yeah. Okay, Len has been in Binghamton because of the workload in Binghamton until this week. He's now back in Oxford on Wednesdays. I learned that this morning from Pam Tanner, who is the VCO for Otsego, Delaware, the other counties. I think she has 4 counties. So, wherever this position is afforded, there is help out there to establish a solid program for Chenango County. But you got to get somebody in there.
Joe, there's been a proposal, and it's, and I know your uncle passed, he was killed in World War II as well, so Benedetti's have served, and
A lot of people serve.
absolutely, but the proposal was around 16,000. My argument was, and I think it needs to be ready to grow, and that probably wasn't enough to get things going. But I wanted to know, it's part-time is what you've been in it. You think it's part-time, and what do you think they need for support and things like that?
Well, again, the program is in infancy.
Yeah.
Okay. I think reaching out to the other VCOs to see how they established their program, and I'm going to take Jack because he was my point of contact.
Mm-hmm.
Okay, for whoever.
How many years has he been there?
7 years.
Okay.
His job's actually advertised. I think they've probably filled it. And his position is 51,000. And after 7 years, that's what he developed. Plus, he has another full-time VCO, and he has a full-time clerical clerk.
Yeah.
Okay. Okay. So his overall budget for Otsego County with the same comparable veterans
Correct.
is $155,000. So if you said 3 years from now, that VCO for Chenango County comes in here and says, look, folks, I can't do it for part-time. These are my hours I'm doing this in. We need a driver, okay? We need clerical staff. Is that individual gonna be, standing against the wall? Is he gonna be banging his head against the wall to fight for a position that's been vacant for a lot of years?
But what would you think initially to get this going? Because it has to have built for success.
Oh, absolutely.
And if you don't build it for success, then it's not
Gonna
going to.
fail.
Exactly.
Gonna fail.
So what would you suggest? That's what I'm trying to. I mean,
Well-
we've had those arguments.
Response to that, ask any director here in Chenango County if they would do their job for $16,000. Follow what I'm saying?
Yeah, absolutely.
Okay, all right. I don't think you'd get one candidate.
No, I know that. What do you think they need for support?
I'm
Things like that.
I'm
just
gonna
trying to-
say that you're gonna need a full-time driver. I think you're eventually gonna need a full-time driver. Again, we don't know how many veterans that are going to be walking through that door.
Right.
We
That's
know
the
the
thing.
populace is here, okay? I can't tell you how many have gone to Otsego County or the state VSO. There's a lot of thought that's been mentioned prior, that why should we have a duplication of services when we have the state right here?
I've heard that argument. I've been through that.
Okay, I've heard it.
I've heard it, and I'll just give
That's
you.
neither here nor there. It's
Right,
neither here nor there.
right.
Okay, we're not going to kick that can. It definitely. Here was my thought that I had with an individual earlier last year, and the proposed back then was $9,000 or $9,500. That's pathetic.
Mm-hmm.
If you take that overall budget for the county, that's pathetic.
Because this is going to have to get funded. That's the thing. It has to go to finance, and that's where you've got to put a number on it. And realistically, and I'm going to be honest with you, I'm not the person that can. I can only say what I think, but I don't have hardcore.
Right.
evidence.
I honestly don't have hardcore facts, okay, of how much it would cost.
But initially, what would you think? Obviously, it's going to grow.
Excuse me, Bob. Bob, let me ask you this: if we went back and we do our group thing and brought you a proposed budget, if you will, for this office, will that help? Or you want us to just throw a number on the table right now?
I just think you have to know what the support is, what you're going to have to do for, because there is going to have to be advertising. This is something that's going to have to be looked at. You've got to grow it, and you got to have money. Because my thought is, if you're just putting 16,000 out there, somebody's just pulling this out of here.
Right. Oh, absolutely.
And guess what? Somebody's going to get disenfranchised and just say, this is.
I mean,
I
we
can't
need to
get
do it.
anything
We need to
started.
do it the right way.
Absolutely.
Right. And I mean, I think throwing a number on the table is not the smart way. But I mean, I think if we went and put our collective heads together and put something solid on the table, I think it.
That's
more
where I think it's got to
palatable for
start,
everybody.
because you can't just, it's got to have some thought put behind it and present it to the finance.
I'm
Because
not-
otherwise, finance, they're going to say, where'd you get this number
We
from?
got another speaker here, and we're already well over time, so can we?
But the only thing, those are my
Focus here.
questions, but those, in order to get going. Mr.
Actually, we
Chairman, I
don't have
understand.
the other speaker didn't come.
Oh, okay, well, we're still over time. We've got other
right.
things to do here, so.
Okay, so if we decide to table this for like another month, okay, we're looking at this person not getting the training till September or October. Are we okay with that? That's the thing, because they're saying that, we really need to get somebody registered by March 1st.
The law
So now
does-
we're really looking at another 6 months.
The law does stipulate, though, that they do have somewhere between 18 months and 3 years. They have to be certified within this amount of time, and the organization has to be certified as an organization as well. But it does have, I think, a 18-month to 3-year window.
This has already been approved by Health and Human Services, and it's already been approved by personnel.
That's what I
It's sitting on, it's been tabled in finance, and so that's why the talk goes back to the dollars and cents. how much do we allocate to get this going? How much, it certainly is an essential service.
So let me ask you this question, okay? My question is this, okay? And I gave this example last year. I had the idea for a VSO to be in the Office of the Aging. I had the idea of maybe giving one of the secretaries or one of the clerical people there a stipend to answer the phones for veteran services. That individual would document, call for veteran services so that you can monitor or record how many calls into the Office of the Aging / veteran services for an individual. Part-time to start, okay? Not knowing what you would give a person for a clerical person, a stipend, I couldn't tell you, I don't know. The number that I heard recently, it was mentioned to me, that the board had looked at a $12,000 budget. What does that cover? Does that cover clerical? Does that cover expenses for an office? Does that just for the director themselves? If it's just the director himself, that's disappointing. It's disappointing because that veteran is also a veteran and he's worth more than that.
Question, what has already been approved by the committee? Is there a dollar amount attached to that that was approved here? There is a budget sitting in referral in finance that we're, part of the reason that it wasn't put into the budget this year is because we didn't have that person or any indication that we can find a person to fill that position. So we did not feel that we should be taking tax money to fill a program that wasn't in existence yet. So that's why it's there. As soon as we get, I'm assuming, as soon as we find somebody that is a potential candidate that looks really well at that, then we will move forward with those types of things. Bottom line is, we have not been able to find a person qualified and willing to do the position, and that's where we're at.
So I have to ask this question. When I had the meeting with the chairman of the board last year, and I offered to help him start this program, what more do you need?
My understanding was, and you'll have to correct me if I'm wrong, because I'm hearing this third hand or fourth hand, was that you offered if the position was a position of a big department, not what we were looking at to start with. Okay, we got to start somewhere.
Oh, I
like you said.
understand that. No, that's not true.
To go out and start a $160,000 program like Otsego, we can't do that in the climate that we're in today without shutting down other programs that we're already doing. Now, I understand that our veterans deserve more than they're getting, and there's no way we could ever give them what they deserve for what you guys have sacrificed and that kind of thing. But we also have other people in the county that that we've already been doing things for, and there just isn't money out there without raising taxes substantially, to start a huge big program. So we need to start somewhere.
Well, I understand that. I understand.
And we need somebody willing to start where we're starting and have the focus that we have.
And where's that start?
The proposed budget that was put forward was $15,200.
$15,200.
15,200. I believe there was $12,000 salary was what was suggested by this committee, and the rest was office expense and, you know, incidental expenses, so another $3,200 in. And Joe, what you've said is correct, that there is some willingness in the Office of the Aging to pick up some of the clerical and some of those things. But that, there again, that's a thing that's, you know, kind of a work in process of knowing. We have to know that the individual is going to be, the Veteran Services Officer is willing to work with that, in that climate. You know, it's a thing that, but I think that, as Jeff said, the thing lies on the table at finance because of coming through at budget time and not, and, you know, we have tried to be very cautious for our taxpayers in Chenango County and not raise taxes so that we can stay within the tax cap, good or bad. You know, that was a hand we were dealt. We didn't account for it. And even though it was only $15,000, that was about the freeboard that we had in Chenango County's budget to play with at the end of last fall. It's not the thought that it wouldn't be funded if it comes to reality, but there's no. The thought was, let's not fund something and then not know what we're going to fund or, you know, where it's going to go. So that's where, you know, my suggestion is that it come back, that it be asked to come off the table at finance, and because that's the committee's choice. But, you know.
Under my original proposal, okay, of that budget, it was a number. But in my, I guess the duties of the VSO, I was to get things started at a small scale. 3 days a week, 4 hours a day. What's it worth? I don't want an answer now, all right?
Right.
But
We've had this conversation. so
yes, we did.
all right.
So, you know, before we had volunteers who were getting nothing and doing a lot. And I thank them for that service, all right? Also too, and I thank the VFW for creating the
DPA,
driver
yeah.
program going. I think that's working out very well for a lot of veterans, all right? So if we can just not, if that can still stay maintained, that'd be a great asset. But again, I wanted to get the ball rolling with something like that. So whatever that time is worth, it's up to finance to determine that.
Right.
And if we would be able to find an individual that would be willing to, and I'd still call it a volunteer position, even at that pay. All right, so, thank you.
It seems to me right now, you're here and you're thinking in the right frame of mind. But you've got to put forth a job description out there to the public so they know that this is available. Who's going to write that job description?
It's already been written.
Yeah, let's get it done and then see what comes out of the woodwork. You know, probably 15 is a good way to start.
Legally, we have to have it financed, we have to have it appropriated before we can advertise for the job.
So we're
You're
talking
saying
in
law.
circles here then. We can't finance it because we don't have a position, but we can't advertise the position because we don't have it financed.
You know the biggest help that you people can do? We had a commander of a region was here, and I put forth the same thing to him. The biggest help you guys can be, you have the opportunity, you know the veterans that are out there. Find us the guys that we need to be looking at, or the people, I don't mean guys, the people that we need to be looking at. Find them for us, get them in contact with us, let us talk to them and find out if we can make it work with them. That's what we need. Advertising for the whole county isn't gonna do that.
Who do you want them to contact? Us, who's just all you people on this committee, or?
Okay. Mr. Santiago has the job description. He's the
He's the
He's the
VFW.
VFW commander.
Yes, I'll talk.
He has that. That's what I did for him. I got it to him.
We got it posted.
Well, I can't, I'm not gonna go out and find people.
As far as a contact person, I see.
I am interested in it. there's gray areas here that I think that we need to address.
I think you're looking for support to say, okay, we get this growing. Is there support there?
Yeah.
I'm looking at this, okay, I was there, I'm gone. I talked to Lawrence Wilcox last year in July, okay? We're still here, doing the same thing, all right? I'm still here, trying to push this forward with a group that I didn't even know existed until 2 weeks ago, all right? Who are my support for you folks, not against you, not against you. But in order to have a viable program, yeah, I agree that we should start out small. But let's make it so that it's efficient enough and viable enough so that the director doesn't fall on his face because he doesn't have the support. Because otherwise, again, if I was to take the position, it was like disappointed twice. And I'm not gonna like that. So.
We need commitment. We made a commitment to our country. We need a commitment. We pay taxes too. I pay a lot of taxes. A lot.
I'd like to make a motion to bring this back to finance, to get it off the table. Take it off the
I'll
table.
second that.
Okay, now this is a referral to finance to ask them to bring off the existing budget off the table and
Yes.
enact on it.
And that-
Okay, you got that? More or less? Any other discussion on that? All those in favor?
Aye.
Opposed? Carries.
Thank
I
you.
really appreciate you
Ladies and
guys'
gentlemen,
service.
thank you for your time.
No, thank you very much.
Appreciate your time and your passion.
All right, see what happens. Keep me posted.
Yes.
Be nice to your husband.
Why? Let's start now.
And to your veterans, whether it is New York Run for the Fallen.
You don't catch me doing it, I can't even get the stairs.
We're looking for sponsors.
Oh, sorry, Ed.
Yes, how are you? Geez, I don't know anybody, but,
Yeah, I'll go down and get a cup of coffee or something. No, that's where it went.
Actually, if you could ask Pam to make some copies and put it in the box.
all right.
Yeah.
I haven't seen
Find
it.
out.
Again,
Just go
it's
in
called
there.
networking. It's called networking.
And right now, ask the secretary in that office. That's all he needs.
Will you stay?
When the final,
10 o'clock Thursday.
10 o'clock Thursday?
Board members, because I could,
All right.
All right.
thank you.
Sorry.
No, I appreciate it.